group is now focusing on the composition of the microbiome in patients with MS. And we also check the gut microbiome. So in many countries or in many research groups, so previously analyzed the composition and function of the gut microbiome, fecal microbiome in MS. But composition of salivary microbiome is largely unknown. So the previous report is very limited. So we first evaluated the composition and the characteristics of the salivary microbiome. And in our group, so we analyzed the various composition of salivary microbiome in various clinical phenotypes of MS, including the relapsing-remitting MS and secondary progressive MS and neuromyelitis optica spectrum disorder. And also, we check the subclinical subgroup of the atypical MS. So this is a very uncommon in Western countries, but in Asian countries, particularly in Japan, so we often encounter this kind of the patients. So in these patients, the characteristics of the MRI is very peculiar and it's very different from the typical type of MS. So they lack the very typical, MS-specific lesions, but so disease modifying therapy is not so effective. So this is the clinical characteristics is very similar to NMOSD, but certainly negative for various autoantibodies, including the AQP4 antibody or MOG antibody, and there is the clinical characteristics is also different from NMOSD. So we analyze the composition of salivary microbiome in various phenotypes, various clinical phenotypes of MS, and for the first time characterize the composition of composition of various clinical phenotypes. And at the same time, we also evaluated the potential of diagnostic biomarker, so using the random forest algorithm. So this is a machine learning algorithm, so to predict the area under the curve AUC and the diagnostic potential. Using this methodology, we evaluated the potential of diagnostic biomarker of salivary microbiome. And in the comparison between the relapsing-remitting MS and healthy control groups, the area under the curve was about 0.94 in the main cohort and 0.83 in the replication cohort. And at the same time, we also compare the diagnostic potential between salivary microbiome and the gut microbiome, fecal microbiome in the exactly matched patient cohort. In the comparison between the RRMS and healthy control, and the AUC value, so based on the based on the saliva data, was markedly surpassed that of the fecal microbiome. So we think that the salivary microbiome, which was not so well characterized in the previous research, but we think that this is very useful diagnostic biomarker. In the results, so in the characteristics of the salivary microbiome, first, there is no significant difference in the various parameters of alpha diversity, but there is a big difference in the beta diversity between various clinical phenotypes of MS and healthy control. But the difference between the in any pair of the patient group was very small. So there is big difference in the composition from the patient and the healthy control. But among the patient groups, there was not so large difference. And in the phylum or genus or species level resolution, there is a much significantly different taxa, so including the significantly increased actinobacteria and the significant decreased protobacteria. And at the genus level, the abundance of Streptococcus and Veillonella was increased, and Neisseria and Haemophilus. So which that kind of the anaerobic pathogenic species was significantly depleted in that results. And in the random forest ROC analysis, so we detected we confirmed the salivary microbiome is a very good indicator of the diagnostic tool. So based on the this kind of AUC analysis that I mentioned in the last section. In the next step, so we'd like to challenge about the whether the salivary microbiome dysbiosis is a cause or consequence of the MS progression or MS initiation. So in order to review that, now we are ongoing doing the notobiotic experiments, so transferring the specific target salivary bacteria into the germ-free mouse and induce EAE and evaluate the phenotype of the EAE or various immune cell populations. So if the specific salivary composition enriched in MS patients exacerbate the neuronal inflammation, so probably that is a very important implication. So if we modify the composition of salivary microbiome, so it might be the therapeutic option. So in the next step, we would like to the cause or consequence problem using the rodent model. So now we are going to do that kind of research, and in the future, so we'd like to make a presentation regarding the results.